I'm Dr. Vijay Chawda, a resident of Mumbai, and have done my MD Radiology and diploma from Mumbai University, which was prevalent at that time. That was somewhere around 30 years. It is now that we have Maharashtra University of Health Sciences.
Doctor, what is the one case or achievement that you will always stay closest to your heart?
Just way back when I was a junior resident, I had diagnosed one case which I did not know. I did not expect anyone in my senior faculty also to diagnose, and my boss was very happy with me. That was the case of a small child whose X-ray was taken for X-ray of the chest, and I had diagnosed perforation of the intestine from the chest X-ray. That is something called football sign, which is written on old textbooks, and I don't think any new radiologist will be able to pick that particular thing up.
What made you choose radiology?
I chose radiology because I have a picture memory. So whenever I look at a picture, I can definitely keep those particular frames in my mind and recollect whatever I had seen. This is not definitely pertaining to numbers because I'm very poor in math.
How important are X-ray and MRIs in modern medicine?
See, X-ray and MRI are two different modalities. X-ray is very important for the basic investigations. MRI is the last investigation. So actually both are very important.
Is radiation exposure dangerous for patient?
Definitely yes. If you go on getting yourself X-rayed repeatedly, the X-ray radiation will have a cumulative effect. So one day certain dose, second day certain dose, it goes on adding. So at the end of the year, you see the amount of exposure received by a patient goes beyond expectation. That is precisely the reason why if you see X-ray technicians, they wear a radiation badge to monitor.
How do radiologists help in early cancer detection?
It is the interpretation of the shadow. Radiology means X-rays or any other procedures like the barium procedures or IVP procedures. Those procedures will be able to interpret by radiology in a form of a shadow, a mass effect, and that is how you can find out if there is a mass region or a cancer somewhere.
Which scan do people fear most unnecessarily?
Obviously, X-rays, CT scans. These are the two modalities where involve ionizing radiation, and these are most fearsome for the people.
How accurate are CT, MRI reports in diagnosing diseases?
They are complementary to the X-ray, and they go little bit more deeper into the planes of the particular patient's body. So like if I see a X-ray chest where there is a small round shadow, to evaluate exactly the depth of that particular shadow and the tissue diagnosis, CT and MRI helps.
Why it is important to get scan from trusted centers?
It is possibly because trusted centers are probably having the better equipment, better machine, high technology.
Can lifestyle habits show up in radiology reports?
Definitely yes. If you smoke 10 cigarettes a day, it will just show it on your chest.
Your most memorable diagnosis?
The small child with X-ray of the chest, and I diagnosed the perforation. The second thing which will come to my mind is one of our colleague, a senior general physician. He had come for the X-ray of his shoulder joint, and I had picked up a very small X-ray, lung cancer.
One myth about scan you will like to clear.
One myth about scan, that means you have cleared me for X-rays, because X-rays are not scans. So only thing remaining is the CT scan and an MRI scan. Now the myth about everything is that what people feel that when doctors do not understand anything, they advise scans, and possibly for the benefit for more for the doctors than the patients.
Doctor, what is the one case or achievement that you will always stay closest to your heart?
This is something called heterotopic pregnancy. A lady had come for her pregnancy ultrasound test, and I had diagnosed the pregnancy which was there in the uterus also, as well as it was there in the tube also, which is called ectopic pregnancy. And this is one of the rarest things that I have seen. And second thing I have seen is twin ectopic pregnancy. Means the pregnancy was there in the tube, but there were twins, which is one of the very rare things.
What made you to pursue sonology?
Again, the likeliness of imaging, and second, the most important factor here is not involving any radiation. So I am safe as far as my practice is concerned, because sonography does not involve any radiation.
How accurate are ultrasound in diagnosis?
It is very accurate if it is done logically and if you have a good machine. Again, I will tell you one more thing. It is not the machine which is important, it is man behind the machine which is more important. So if you can give me any good machine, I will be accurately able to diagnose majority of the cases.
What can ultrasound reveal about heart, liver, and kidneys?
Yes, it is basically to see the solid organs. For heart, you see you have 2D echoes, and for liver and kidneys and all that, you have abdomen ultrasound.
Is ultrasound safe during pregnancy?
Definitely yes. That is the reason why radiologists and sonologists are still surviving. Because in one pregnancy, you at least get the same patient 5 to 6 times, which is not bad.
How often should one go for a preventive ultrasound?
Preventive ultrasound is just like health checkup. How you do your blood test once in a year, or if you are in a corporate business or corporate sector, your employer sends you for some investigations, basic. Some include abdomen pelvic ultrasound, some include only X-ray chest. So depending on, but I think preventive ultrasound is as good as getting your initial diagnosis done.
What is the most common finding in routine scan?
In males is fatty liver because of the lifestyle disease, and again in young girls I've seen quite a few of ovarian problem, which is called polycystic ovaries.
Most surprising case you diagnosed through ultrasound?
Exactly as I said, heterotropic pregnancy, where the pregnancy was there in the uterus as well as in the tube, and that was a diagnostic challenge because majority of the time when you look at the uterus and when you find the fetus inside, people have stopped looking surrounding structure.
What is the difference between ultrasound and other scans?
Ultrasound is the only imaging modality which is operator dependent, in the sense the doctor himself produces the image. Rest of all those X-rays, CT scan, MRI scans are machine generated. So patient goes into the gantry, machine takes the image, radiologist sits in the AC room and interprets those scans. Whereas tomorrow, even if you give me one ultrasound film and tell me to interpret, if it is done by me, I will be able to interpret. If it is done by someone else, I don't think I will make an even attempt to interpret it. Because on ultrasound, I can show you a patient with gallbladder stone, the same patient in a different scan where the gallbladder is there but there is no stone. So it is 100% operator dependent.
A common myth about ultrasound?
It's the same thing, like how people have learned initially the X-rays came, so they said they were harmful. It is the same myth which is carrying on, that even repeated ultrasound will harm the babies and something like that. I don't think it is true at all.